நாளை வரும் என்று நம்பலாமா? நாளை வரும் என்று நம்பலாமா? நாளை வரும் என்று நம்பலாமா? கந்தன் தாழை பணிந்தருள் பெற வேண்டாமா? நாளை வரும் என்று நம்பலாமா? கந்தன் தாழை பணிந்தருள் பெற வேண்டாமா? நாளை வரும் என்று நம்பலாமா?
Kidney disease and children. Act early to prevent it. Very important. I can think of 3 conditions I would like to talk. One is called reflux nephropathy. See, this is an abnormality where the child is not, when the child passes urine, instead of the urine getting out fully, it goes back to the kidney. Normally there is a valve which prevents the urine going back to the kidney when the bladder contracts. Whereas these people, the valve is deficient from birth. So you find that the urine goes back to the kidney and damages the kidney. What is the marker for it? How do we know this? Nobody knows. I can't cut the child and see, oh, there is a reflux or something like that. The marker for this is a urine infection. If a child gets urine infection, immediately you have to investigate. You have to look for this particular abnormality. Correct that. Prevent infection. Then the kidney will grow well. The child will not get kidney failure. So a very important condition called reflux nephropathy. Second important condition, IgA nephropathy. Now, if you see in 70s, Japan had the largest number of youngsters on dialysis because of this disease called IgA nephropathy. Now, IgA is a substance, it's an antibody that gets deposited in the kidney and damages the kidney. So, the Japanese government started a program in 1970s, imagine, that every year the urine of a child every year should be tested for albumin and RBCs or blood. So with that they detected the disease early, gave sufficient treatment, and now you find that India has much more IgA nephropathy than Japan. Japan, it has gone the lowest in the world because of their vigorous government-sponsored program in school children insisting that you should test the urine for albumin and RBCs every year. Of course, what are we facing now? Lifestyle diseases. In schools and colleges we are facing lifestyle diseases. I was just talking to Vidyaakar. He is running a school with 1,800 children. One of the biggest problems, we went to the school children and colleges in and around Chennai, and we found that 18% of the children are obese, overweight. The type of food, lack of physical activity. And you find that almost another equal number, 20% have pre-hypertension. 5% of them have frank hypertension or high blood pressure. Imagine in a school or a college, a child having a high blood pressure. So these are in future these people will get kidney failure.
Prevention of chronic disease as far as paediatric is concerned is avoidance of consanguineous marriages or arranging marriages between people who harbor within them certain diseases which are recessive. They don't express the disease outside, but they carry the disease inside. Normally, the kidneys goes from the day of conception till about 35th or 37th weeks of pregnancy. Only then it reaches full capacity. Suppose a child is born earlier than 32nd week. That means he is born with insufficient amount of kidneys, nephrons, what Dr. Ravichandran said, or they are not mature enough to take the job. And they don't grow. Once they grow outside, they don't grow. Only so long as they are within the abdomen, mother's uterus, they grow. Once they come out of it, they don't grow. So just imagine a mother not taking enough proteins, enough calories or whatever it is, and she gets a child which is low birth by preterm. Here is a child, a potential child for chronic kidney disease when it grows up. The next important thing is the low birth weight children. That's why I told you. Like, it's the preterm children who are born early. Again, they have no time. Low birth weight child again. Next is the micronutrients like zinc, vitamin D, certain things which are deficient. They can also contribute to congenital anomalies of the kidney. So, maternal nutrition is a very important thing for prevention of many chronic diseases in children. A good antenatal checkup and early diagnosis can, to an extent, prevent this. So here's another prevention thing. And I told you about the infection. The third thing is we ought to have is metabolic disorders.
As far as I am concerned, we have a great responsibility in bringing awareness in the society. Every one of us, we are the fortunate ones. When we say that it is fortunate ones, there are so many unfortunate ones. I always tell my children of Udavum Karangal, don't look for many more things. We need to lead a moderate life. You are the fortunate ones. Still there are so many hungry waiting. Anything can wait, but not hunger. Isn't it? So it is sad. So children need to be educated. They need to be sensitized.
Nammalwar was telling he was suffering from the rare disease called cystinosis. Yeah. Why, Bob? They have a familial disease. It runs in the family.
Good evening, everyone. Today we are all here to create the awareness, to act early, to cure all the kidney diseases. And worldwide, there's so many people, millions of people having kidney damage, which includes children. And I just got, while reading, I just went through that in children, it's very difficult to identify in the early stages. And I really want to thank the foundation and Dr. Ravichandran for taking care and being such a big support for all the kids over here and many more people around the world. Thank you.
ரொம்ப அழகா சொன்ன குழந்தைகளை பிஃபோர் த பப்ளிங் யூத் ஃபேட்ஸ் அந்த குழந்தைகள் வந்து கிட்னியை பார்த்துக்கணும்ட்டு அதுக்கு அம்மாக்கள் ரொம்ப முக்கியம். அம்மாக்கள் நல்ல நரிஷ்மெண்ட் சாப்பிடணும்னு சொன்னார். ரொம்ப நல்ல குட் மெசேஜ். ஐ எம் வெரி ஹாப்பி. I am very happy that Sapiens Foundation, they are doing a yeoman service.
The function is appropriately coming to a close, and I acknowledge firstly the support of Mr. Seetharaman of Super Auto Forge for contributing to Sapiens Health Foundation with a donation of Rs 3 lakhs.